Hello, everyone. So we're very glad to welcome Yanaina Chavez-Ugalde. Yanaina is a research associate from the MRC Epidemiology unit at the University of Cambridge. She completed a PhD in population health sciences from the University of Bristol, which investigated the commercial determinants of dietary behavior associated with obesity in adolescence and complex health, and used the complex health systems perspective to incorporate these factors into public health thinking. She has a passion for systems thinking approaches, science communication, and patient and public involvement to promote healthier food environments for young people. Her role is a cross-departmental project involving nutritional epidemiology, childhood development, behavioral science, and population health interventions. So I'll pass over to Yanaina, sorry, bye. Yeah. I'll pass over to you to get us rolling and look forward to hearing about your paper as well.
Thank you so much, Daniel. Drink some water. That was a bit of a mouthful.
See, my lips are dry.
I can't even say it as fluently as you did, so well done. All right. Well, I hope I make justice to what I want to present today. So let me go to the start and put presenter mode. There we go. So you should be yeah, can I just get a thumbs up that you can? Perfecto. All right. Well, Daniel definitely gave a good intro of where I'm coming from, and indeed I'm a postdoc at Cambridge, and it's been fascinating so far. And having been trained as a food engineer, systems thinking was always in the forefront of my thinking, but it was, as I come to know now, simple complexity. And human behavior is wicked complexity or complex complexity. So that's what we're dealing with in public health. And today we'll present a part of my PhD, and quite frankly, the study that I enjoyed the most. So I hope you enjoy it. And I'll give you a bit of a brush through because it will be easier to read the paper whenever at your leisure. But if you have any questions, we'll leave some time at the end. So online systems mapping using group model building, that's the title. You can scan that QR code, which is the paper. And there we go. So the question is, how on earth did I arrive to that map? So yeah, in the PhD, there I am, swinging away at the beginning, thinking everything will be very linear, and simple to achieve. And the idea was to quantify a part of the foresight map and turn it into a simulation.
Sorry, yeah? Sorry to cut in. I've noticed that I think it's frozen. You're presenting because what we can see now is just you're presenting, not even the presenting view, just the PowerPoint and your notes. I don't know if that's what you're looking to present.
Are you not seeing my slides, the foresight map?
No, the map isn't showing. I can see just the PowerPoint view with the notes, but it's not presenting yet.
Oh no, you can definitely skip let's just quit the presenter view. So yeah, the idea was
Yes, that's showing.
Is that cool? Perfect. So the idea was to quantify a side of the foresight map of obesity, which represents all of the complexity of the causes of obesity that lie beyond, well, that include genetics and individual factors, but basically that include an array of external factors. And as I said, being a food engineer, the food production and the food consumption seemed an easy way, an entry point, let's say. And the question was how to go about this, right? You have commercial determinants of health, systems thinking approaches, obesity prevention efforts, what population to focus on. So there was a huge gap in my phases at the initiation of the project. So narrowing it down, the aim was to explore commercial determinants of dietary behavior that were associated with obesity in adolescence. And I know that there's the whole literature on commercial determinants of health, but food industry acts in similar but very subtle different ways than other commodity industries, because food, we all need to eat to stay alive. It should be considered a human right. It's not recognized as so yet. So that's why that narrowing down into dietary behavior and adolescence. And the idea was to use a complex systems perspective to incorporate it into public health thinking. So this is kind of the breakdown of the thought of the PhD. Indeed, I managed to do a systematic review on defining how commercial determinants of dietary were seen in the academic literature. And today we will focus on the system mapping. And the idea was next to do system dynamic modeling and some policy testing. I found that systems thinking was a buzzword, but not very broadly used in public health. So I delved into the literature. This was the first book I encountered by Sandro Galea. And it was fascinating to see some examples on how to go about it, but didn't cut to the chase of what I needed at that moment. So I continued my exploration. Donella Meadows is almost like a poet. If you can listen to anything that's online or read her book, it's fascinating, and she really breaks down very complex concepts into very graspable things that you can actually put into practice. Then the fifth discipline is almost like philosophical book. Systems Change for Social Change, also very, very interesting read. And indeed, the work by Cecile Nye, Matt, Elizabeth McGill, Vanessa and Mark Pettigrew guided a lot of how I conducted my research going forward. And there are some good recordings on the Health Foundation that you can go to. So I'm not going to dive into this, but just on my reading, there are so many definitions of what are systems, what goes into the boxes of a system map, etc., feedback loops, stocks, flows, interventions, co-benefits, leverage points. But also going back into, well, where does health sit within complexity sciences? And Castellani developed kind of this map, which seems, you don't have to look in detail into the boxes, but every color signifies intellectual traditions, which all of them are trying to tackle social ailments of our time. And I'll go back, but if you can see, the year is in another slide. I'll tell you in a second. So complex systems theory, cybernetics, artificial intelligence, this is how the map is connected. There's a historical period in time. There's a scholar name that kind of influenced that field of research. And the question was, well, where does healthcare sit? And in the far left, you see that complexity sciences started in the 50s. This is not new. However, if you go to the far right, 2010s, that's where we are, healthcare and public health. So actually late 2010s was starting to be used by iconic figures such as Kaplan, Anna Diaz-Ruz, fantastic work, Megan Patterson, and so on and so forth. Like there are many influential figures. This is a map that's being updated with certain frequency, just to put in what's happening in complexity. So synthesizing the readings, I came to understand that there's systems thinking. This is rooted in philosophy. It's a way of thinking, a way of saying this is how the world is connected, that is way beyond an individual. We're connected in different ways, almost like the butterfly effect, and living by that. But then on the other extreme, you have the complexity sciences, which is more rooted in mathematics, modeling, simple complexity, let's say, but that can mirror the complexity of our time, which is wicked behaviors, like how can you predict human behavior, so complex. But I found that system mapping was in a continuum, and you can use system mapping from rich maps, concept maps, rooting from the systems thinking tradition all the way to complexity sciences, for example, system dynamic modeling. So my focus on systems mapping, as I said, the idea was going to system dynamic modeling eventually, but I went into the literature. Okay, if I want to do a system dynamic model, what literature can I bring into my thinking that can guide the methods I wanted to use? So first I did a literature review and an evidence synthesis of how the academic world pictured commercial determinants of dietary behaviors, right? And as I said, the academic literature can be narrow in the views that it doesn't really portray lived experience, but there we are. And we have, this is almost like a concept map signaling that food industries act in 3 specific spheres of action: how they shape the political and legal environment to make everything legal, although it could be lethal. The processing design of their products, how they can maximize profits, increasing market shares and building up agribusiness supply chains that can reduce the cost of the products that they do the foods with, and then the marketing and preference shaping, which is way beyond the food, but that makes us desire certain products. Because of kind of Coke they don't sell, carbonated water with sugar and caffeine. They'd sell it as joy and connection, and youth and magic almost. So there's a lot that goes into the marketing sphere. So there we are. We have an academic view of what commercial determinants are. My interest was, what's the adolescent's lived experience? So for that, in order to do a system dynamic model, I used this book, which is 1996, but quite frankly, it breaks down in such detail and so much practicality on how to do a system map, specifically a causal loop diagram. So assessing causality to the boxes that you see in the nodes, and I'll explain what that means in a second. Also, I use Scriptopedia. It is an online platform for free. It's an open platform where you can see a lot of scripts that literally describe how to go about conducting a system mapping workshops to have a causal loop diagram. And I'll show you which ones I used and the benefit I found in each of them. So in the end, the group model building exercise that I did was intended to be in person, but COVID hit and I had a format. So today I'm going to talk to you of how the research question was basically, what do adolescents think that food and beverage companies do to have an impact on their choices and their friends' choices of what they choose to buy and eat, and why they thought that those things had an impact. The output was a system map or causal loop diagram that reflected the factors. Now, a causal loop diagram is a tool that allows you to connect with each other. What is the story that's building up how the system behaves? This is not evidence-based in the academic literature, but this is experience-based on the adolescent's lived experience. And I find this extremely valuable because if we're trying to do some public policies or anything to do with communication of science, and we don't include the people that are being affected by these policies, I think our job is a little bit wasted. So including their views and allowing them to portray their lived experience in a way that they see the interconnections of the factors that lead into a certain behavior became a very powerful tool for them to be able to have a voice in research. And then this was showed to policymakers, and they found this also extremely useful in terms of a communications tool. it confirmed what they thought were the drivers of commercial determinants of diet in youth, but also it allowed for them to vent their frustrations on some policy that they know what they would like to do, but they're hindered by the system that we're living in currently. I'm aware that this slide is quite busy, but if we break it down, you can see that COVID had a big impact. So I did myself a bit of introduction to systems dynamic literature. I developed a group model building project description. COVID hit, but then I had to phase was the planning and adapting of the method I was going to use. Then I continued with process mapping, identifying the scripts through Scriptopedia, as I explained, developing an online agenda, having in mind, how do I reduce participants' burden? Participants being adolescents that are having to adjust to an online format of having their schools, that they were engaged with me, trying to learn new methods of engagement in an online platform to make it safe. And then I went on to do some piloting with members of Bristol research, the medical school. They helped me kind of to think on the timings and how to do that. I strongly suggest that piloting, whatever you're going to do, helps you to see what are the flaws in what you're doing, especially when you're adapting something that's been trial and tested in face-to-face. And I will go into the detail of the facilitation and delivery. And I'm aware that the last colored section seems quite busy, so I'm going to break it down. This is the outline of what happened in the group model building session. So I broke it down, as I said, to reduce the burden of the participants being online. I had a first session, which was an introductory session with each of the teenagers that I engaged with. I engaged with 11 of them. I introduced them to the project, the research question that we were exploring, the one I showed before, introduced them to systems thinking concepts. So we did a test run of, okay, tell me what influences would you choose to buy and eat? And like marketing. Okay, marketing. Marketing is something that can be increased or decreased. What happens with marketing? So you see marketing and what happens next? Okay, I am prompted to eat. Okay, so marketing, an increase in marketing increases your likelihood of consuming that food. Yes. So we went back and forth of give me these factors that can increase and decrease, and that connect with something else that caused something else, if that makes sense. So we did this test run and they were like, yeah, that's exactly what I'm trying to say. So we did individual maps with each and every one of them. I merged the maps to create a seed map, which is actually one of the scripts advised by Scriptopedia. Merging the 11 maps, it was just an exercise to start session 2. Having the seed map allowed to have the workshop as a group. So the 11 adolescents that I had individually, then I had them in the group model building session as a group. They were already aware of the problem that we were going to deal on that day. They already had some systems thinking concepts in their mind. When I went like this, like crazy. So if this connects with this and increase, what happens with the other thing of the behavior you're trying to do? And we are just like going like this, like crazy during the session. But it didn't become a difficult concept to transmit because I already had that preempting introductory session. So we continued building the system map, saying, okay, I merged the individual maps that you told me about. Now let's develop it further. And of course, it changed a lot because now as a group, they refined their thinking. And we made a group system map. And the output was the recording of the session, which helped me to analyze the work accurate way, because when you're doing it on the go, it can become quite mind-boggling. They're all trying to speak, you have to facilitate, to capture all their thoughts. But after session 2, I managed to have a map that I analyzed, I refined it, and then that became a map to validate with them in a third workshop. And I say workshop, but it was, again, an individual one-to-one session with each of the 11 adolescents to say, okay, this is the story that the map you as a group built. Help me refine, help me make sense of it, and tell me if this is reflecting what you thought. So we went. So an increase in marketing increases my desire for the products. An increase in my desire for the products increases the chance that I buy that product. If I buy the product, highly likely that I will consume it. And then consuming a lot of high fat, sugar, and salt products ends up being in weight gain in the long term. Fantastic. So I presented the map to them. They checked it. They changed anything that they thought should changed. And they proposed some action ideas, some policies that could tackle particularly the leverage points. So in systems thinking, when we say leverage points, you're usually trying to find a place in the system that will have the biggest impact. And these places are usually what we call a feedback loop, the causes of the causes. And the kind of the best example of what's a feedback loop is a thermostat. So you set a temperature. If the temperature increases or decreases, it sets a point where the thermostat or the heating system will be turned off or turned off, but it feeds back on itself until you try to reach certain stability. So when you target in a system map a feedback loop, potentially that will reverberate through the system and it will be an impactful way to intervene. So going back to the bottom of this kind of interesting process thinking of the method that I used, the facilitation and delivery was very interesting and I really, really enjoyed it. There was a lot of planning, a lot of testing, a lot of piloting, but I think that the session went really well. So this is, I know that it's a busy slide, but it's just some of the examples of the scripts that I used. So for example, the causal mapping with seed structure, the one I mentioned before, I initially had an initial causal structure that they did individually, and that prompted their thinking in the online session as a group. And you can do it from literature reviews, from previous workshops. It depends on the research question that you're trying to do, and also the availability of the stakeholders that you have. But the idea is to prompt your participants from the get-go so that you can continue. And again, like all of these are on Scriptopedia, they're open source. So I strongly encourage you, if you're thinking on doing a system app on the, as a causal loop diagram, please go to Scriptopedia and I can share my experience with each of those. So this is what the story that they came with. And as you can see, if they purchase unhealthy food, highly likely that they'll consume it, they will have an increased calorie intake, and their weight will increase. But there's so many colors outside the yellow boxes that have to do with the physical environment on the purple boxes. The green ones is a decreased demand for healthy food. The purple boxes are something that have to do around the social media influencers and the body image that social media influencers portray. So it is, from the get-go, you can see that teenagers are immersed in their own lives, of course, but they're very aware of the causes that leads for them to have an unhealthy diet, or a diet that's highly influenced by social media, by marketing, by an environment that's conducive to unhealthy eating, and that can trigger things way beyond food that have to do with negative body image, stress eating, dieting, and a lot of gaps between the actual and the desired body image, a gap between the perceived and actual healthiness of unhealthy food. As an example of a feedback loop, if a consumption of unhealthy food increases, the taste preference for unhealthy food will increase. If you have an increased taste preference for a certain food, you will consume more of that food. So this is a very simple example of a feedback loop that they found. But if you kind of scope out and follow the yellow brick road, you will see that so purchase of unhealthy food also links to negative body image links to stress eating links to calorie intake links to weight links to gap between perceived and actual healthiness of the food. And this gap connects back to negative body image. So probably targeting this feedback loop would be an interesting one and a high leverage point. As I said, they very successfully identified feedback loops within feedback loops. And it was very easy for them once they portrayed their thinking into a system of action ideas. And this is what works, but we very seldom verbalize them and put them in a map. And putting a bunch of stakeholders in a room to agree on what we're talking about, because sometimes we are talking about the same thing with different words, or we use the same words meaning different things. So system map aligns that, and we agree by consensus that, okay, this is the problem, this is what we mean by the words that I'm saying, and this is how I think that the world is driving the behaviors that I am having, be it healthy or unhealthy, at individual level or systemic level. So I find these quite powerful tools. Again, I'm aware that this is very busy, but for example, I asked them, okay, if you were prime minister and you had a magic wand that could change anything, if we regulate social media influencers, this policy could influence one of the boxes in the system map that had to do with social media influencers, marketing of unhealthy products, and the effect it has on body image. And remember that body image was a very busy box. It had a lot of hours coming in and out of that. So the feedback loop that they would influence would be the gap between the perceived and the actual healthiness of unhealthy food and the negative body image. And then I took this to policymakers and said, hey, what do you think? Can we do something like this? And of course, they were like, we know this is a problem, but it's just outside our local authority. And these are the problems that we're dealing with. Identify the complexity of the complexity and the causes of the causes is not enough. So now that we have this visibility, maybe we can try and push the boundaries of the systems that we work on, try to work outside of, I know this is a structural limitation, but this just raises more questions and portrays in a very visible manner where the limitations of the interventions that we're striving to achieve are. And then if we've managed to have leverage in those leverage points, then maybe we can change the system as a whole. So these are kind of overall comments from the policymakers and practitioners. They used it actually in Bristol City Council as a communication tool to communicate the root causes of obesity in a complex manner. Evaluation. Evaluation is very important, and this has to do more with the methodology of how to conduct whatever workshop, but especially systems thinking. And I gave this was an anonymized questionnaire on a Likert scale, trying to evaluate the general aspects of the system mapping workshop. So basically evaluating if they could verbalize their thoughts, if it was a conducive environment for them to do so, if they felt heard. Also, if the purposes that we said we were going to achieve in the mapping sessions were achieved, if there was anything negative of these aspects, and then some kind of open boxes, if there was something that they weren't able to say in the sessions that they wanted to include. Overall, I strongly suggest that when you use or adapt any system mapping exercise, test any technical issues. In my case, changing it to an online format reduces the costs because I didn't have to pay for a room, for catering services, for transport. Think about workshop management. Facilitation skills are very important. We're conducting these kind of workshop system mapping. You need a few people because you need the expert in the topic, you need a facilitator, you need a note taker. So just think about the people that you need in a session like this. And if you're going to deal with stakeholders that have a lot to say, and that probably will have conflicting views with other members of the session, someone that has a capacity to deal with power dynamics within a group. I think as public health practitioners, sometimes we do not have those skills, so it would be good to increase our capacity to do so. Evaluation of the session is very important because that tests the participants' experience, and if you they kind of evaluate you if you allowed for them to achieve the aims that you set at the beginning of the session. However, the validation of the session is a bit more tricky because there's very little literature on group model building online. But as the research on this field increases, we can start to test if actually, I don't think online and in-person are conflicting. I think they are complementary. But as more research emerges, we can see what are the hindrances and benefits of doing it in either format. Maybe we need a combination of both. Some other recommendations I found particularly important that enhanced the workshops I did. When I did this, there was only one published paper that group model building was done online because of COVID. And I based a lot of my work on their work. But I included causal mapping with seed structure, as I mentioned, to prompt participants' views, graphs over time, which is almost like a horizon scanning, and it allows participants to think ahead. If there were no barriers, how do you see this problem developing over time? If there was an intervention, what do you think would increase or decrease? If we think that the event horizon that we're analyzing, something will change in the foreseeable future if no policy is happening. And then some action ideas of, if you were prime minister, what would you change in the system? So of course, these systems thinking, group model building, these kind of methods come with its strengths and with its caveats. I found that group model building online was a feasible, engaging, and enjoyable experience that saved me a lot of money. I think adolescents develop a very comprehensive systems map that reflected their views, their lived experience. They felt valued. They felt that their contribution was used to good purpose, especially when I fed back to them that policymakers in the region had used their views to influence their thinking. Group model building was definitely a feasible approach to involve adolescents in research and to start giving voice to their views. However, diversity of recruitment was quite limited. It was the start of the pandemic. Not everybody had access or knowledge or a separate room to do an online meeting. So this is not an excuse to say, oh, well, hard to reach. I don't think that's actually true, but hard to reach participants. We really need to make an effort to get a diversity of views because we know that health inequalities are quite deep rooted in our food systems. So that's something to improve for future. And policymakers and public health practitioners used it as a communications tool to visualize some factors that they hadn't seen, for example, the negative body image, and to confirm factors that we're absolutely sure that had an influence on adolescents' behavior. In summary, I strongly, not for every problem we need to use systems thinking approaches or complexity science, but for problems like eating behaviors and food systems, I think that systems mapping is quite a useful tool to try and verbalize stakeholders. For example, from farm to fork is a very long route from the farmer to what's in our shelves. So trying to bring together thoughts from the entire chain into something that's visible and quite compelling, that tells a story. We're all made of stories. And actually, this session was moved because we had an NIHR session on storytelling. And if you remember, telling stories was one of the most compelling things to create systemic change. So this is a tool to convey a story, a powerful story of lived experience of people that are highly affected by industrial for-profit food industry complex. And I'm very happy to take any questions. The paper is there if you want to scan it. And however, the findings of the whole, I don't know if it's such a political topic that is taking a bit longer, but anyway, watch this space. So hopefully it will be published in the near future. And yeah, very happy to take any questions.
Thank you, Yanaina. I'm sure there's applause going all around. That's maybe one of the shames of being online. You don't get to have you don't get to hear that applause, but you can see the emojis coming through.
And a huge thank you to my PhD supervisors that really saw through it all during the pandemic and supported me all throughout, because I was like, I want to do food systems, and they really supported me. So Ross Jago, Frank DeVocht, and Zoe Tumpakari, the best. Thank you.
Awesome. So we can go into a time of Q&As. I don't think I've seen anything in the chat, but I have one question. And Connie, I've seen your hand. I'll pass to you. But maybe just to get things rolling. I know this is something that you already touched on as you're speaking. But your thoughts on what goes into creating an engaging online environment. This is a little bit of a selfish question because that's a piece of work that I'm sort of involved in, looking at public engagement involvement using sort of digital spaces. But what goes into creating an engaging online environment for the public using systems thinking, and how does that reflect the real life context that traditional evidence models may fail to take into account?
Yeah, no, it's a really, really good question. And I hope I can answer it, because I think there are two answers to that question. The first one, engagement online and physical can be challenging. And across the board, more and more, it's required from us to engage the public. So having a meaningful engagement that you will set from the beginning of what's the aim of what you're doing, how are you going to inform them back of how you used their contributions to the public purpose. So say, once I finish, this is how I aim to use it. This is how we used it, and this was the impact of your input. That's a very strong driving force for people to participate, and knowing that they're contributing into something that will be put to use, especially by policymakers. Of course, some people want to have a financial contribution. I thank you for their participation, but I find that the driver is something else, is something more, it's something deeper, that they really want to contribute to the understanding of a problem that they're tackling with. So that's, independently if it's online or in person. Online comes with a challenge that it's very difficult to read nonverbal cues. So when you're in a open space in person, you see someone drifting away, you see, the leg just going like, it's like, okay, they're getting bored. How do I switch the pizzazz? So online, I strongly suggest having short bouts of engagement and then some breaks. Highly recommend to do one session where you introduce the topic and test trial the problem that you're trying to achieve, because if not, in the session as a group, trying to keep the boundaries of the system is very difficult. So if you prompt them with, this is the problem, this is the boundary, this is how you're going to go about it as a group, they come very geared to the group session and they're ready to go by the time you start. So yeah, at practice, pilot with people, test run. If you think 60 minutes is enough, sometimes maybe think about cutting it to 15 minutes. 10 minutes online can be a lot for someone that's contributing, especially that we're, meeting after meeting. So make sure you have those resting times. Let them go, think about the problem, come back as a group, feedback. Those would be my topical recommendations, but happy to go into detail in a separate arena if that helps, Daniel.
Yeah, awesome. Thank you. Connie, Connie first, and then I'll pass to Mike as well.
Thanks very much, Yanaina. Amazing talk. Thanks so much for doing this talk for us. And I'll be digging up your systematic review as well. I made a note, really looking forward to reading that. My question was about the online. I think many of us changed to online through the pandemic. I'm asking the obvious question, kind of post-pandemic, what is it you would retain? And do you think there's a place for online group model building? Might it even be more accessible or easier to schedule? Or sort of, couldn't you wait to go back and think, actually, if you needed to make a recommendation, it should be in person? And just linked to that, I thought it was interesting how you moved, I guess, in terms of the design, some of these conversations to an individual basis. And again, I was wondering, is that sort of learning you think actually that could work in person as well? Or is that really a function of the online, or maybe a function of the adolescence that you felt that was really important?
Yeah, no, thanks for those questions. Certainly very important on the practicality. So in terms of in-person versus online, I think both are very valuable. Especially, I think it depends on the research question that you're having and the stakeholders that you want to engage with. So let's say you're in global health and you want to engage with, different prime ministers across the globe or presidents or whatever. Of course, we're doing it online because doing it in person would be almost impossible. But for example, if you want to do school research and you manage to get the students in one room at the same time, do it in person, because you don't have to bring people from Newcastle, London, Sheffield, Bristol. Like if the transport of people into being in one place becomes 90% of your budget, I'd suggest just try to do it online, and it's as engaging. Although the format has to change and you have to break it down into smaller chunks. And again, if you're dealing with stakeholders that have a lot of influence with a lot of power, try to have them in one room at the same time, all of them. I think that will be, it has to do with practicalities, really. As I said, strongly suggest to have an initial test run to get participants acquainted. And I found it easier. We all have different levels or speeds of understanding certain concepts. So trying to get everybody to do it to understand what a feedback loop is at the same time. Some of them will just get out the window and just see you like, okay, I didn't understand, but time's running up. Let's do it. Systems thinking, when you break it down, it's quite easy. And everybody's like, oh, I thought like that, but nobody had taught me how to think about the connections. So the initial systems thinking concepts, if you can do it on a one-to-one to get everybody on the same playing field, they come strong for the beginning of the session. They come equipped with the tools they need so that it's a beneficial and the most effective session, because you won't go back. So what was a feedback loop? So what was a variable? Okay, you have to come with ideas that the things that go into the box are variables, something that's amenable to change. So they will not give you transport policy or the roads. Yeah, well, the roads, what about the roads? It's like, access to transport. Oh, okay. Access to transport increases and decreases. So that's why I strongly suggest the previous one. I think both complement online and in person, but it will depend on your budget and the people you want to engage in, and that you manage to get them all at the same time in the same place. So yeah, did I answer? There were several questions, but I'm not sure if yeah. Again, happy to talk about if other questions come up and I didn't quite answer everything, just send me an email.
I think it's again just constant reminders of how this aligns with those real world contexts. Mike, you had your hand up, but it's just gone down. I don't know if you still want to ask a question or comment.
Oh, yes, that would be great. Thank you. Thanks for the talk. I loved it. And thanks for making it really practical. I think it's going to be really useful for a lot of people. So I had a question. What do you think are maybe strengths and weaknesses of doing this with people all individually versus a group? And do you think that would be viable? One thing I'm thinking is maybe some people are shy in groups, and maybe being individual could help bring out some of those views. However, you don't get to like bounce ideas off each other in the group setting. So I'm just wondering, do you think it's viable? It doesn't have to be an either or, just thoughts on doing this individually as like a primary approach.
Totally. And I think what's in the name, right? So group model building has group in it. But as you say, everybody engages in different formats, and group engagement is not necessarily the forte of everybody. So something that I found quite useful doing the initial one-to-one session, they already gave me examples of what they thought. So the seed map included in one shape or another their views. And that's how the discussion started in the group session. So when we came to fleshing out and refining the seed map so that it became a group map, people that had, maybe they were shy in a group, but they said something initially. And I can almost guarantee they identified where their input was in that seed map. So if anything was unclear, they would jump to say, no, that's not what I meant. Oh, okay, let me help. Let's help me refine it or change it. So even if, of course, there were people that spoke more than others, but I already, having the one-to-one helped me to capture a shape or form of what they thought. Now, I don't think it should be individual or group. I think it's both, because as a group, in the end, you build a consensus of a problem. And what I said, like, are we talking about the same thing with different words, or are we talking about different things with the same words? And when you do it as a group, you manage to bring those two together and say, we are talking about the same thing with the same words. So as a group, you have that consensus, and then having the one-to-one after to validate the map allowed the shy ones to say, I would actually include this other thing. I would actually, the direction of this doesn't seem quite right. It didn't happen. They didn't change any arrows, but some of them gave me a bit more context and a bit more flesh of the narrative of the map. So actually, consensus was built as a group. And then on the individual validation session, they were able to give me a bit more wording and a bit more fleshy of the narrative. So yeah, I definitely think catering for different forms of engagement is key. So do have an individual one if you can, then have the group, and then have the individual. Probably, if I were to go back and were able to combine in-person and online, I would do the individual one online, the group in person, and then the validation online, because you don't have to travel everywhere. And as a group, you have everybody there at the same time, and it's easier to facilitate and to read the nonverbal language occurring in the room. So I hope that answers the question, Mike.
That was great. Thank you so much.
Awesome.
Okay, thank you, Mike. I'll check. Are there any other questions anyone would like to ask, or perhaps any comments from the audience? If not, maybe one last question from me. And that's, so what are you working on now, and what's next for you in terms of systems thinking research?
Sure. So I was very cheeky because I never said that I never went on to do the system dynamic modeling, because I lacked the skill, the time, but I went on to quantify the yellow boxes of the map. And the ultra-processed food concept was quite nuanced at the time of the last chapter of my thesis. So I used the National Diet and Nutrition Survey to classify food items into ultra-processed food and non-ultra-processed, and quantify ultra-processed food consumption in youth in the UK. And that very neatly worked out to become a postdoc in Cambridge, because they had a post named ultra-processed food consumption in youth. So I was like, hey guys, I actually working on that. So I am currently working on that ultra-processed food consumption, and I am using ultra-processed food concept as a case study to exemplify how our food system is broken. So ultra-processed food is beyond the food. It taps into biodiversity loss, marketing, co-option, I would even say human rights, and a lot of power dynamics at a global scale. So right now I'm narrowed into ultra-processed food, but my systems thinking lens is saying, should we be thinking about sustainability and climate change? Should we be thinking about biodiversity? What about the different layers of socioeconomic inequalities? So the latest paper that I'm working on, well, first of all, quantifying ultra-processed food consumption. Adults in the UK consume about 50% of their diets from ultra-processed food. Youth is consuming 66% of their diets, which is the highest seen worldwide. That comes with a lot of long-term consequences health-wise, but we're researching a moving target. The adolescents of today don't have cancer today, but they will in 20 years. So we're, how do we measure that? So systems thinking and modeling, futuristic models can help with that. So I'm aiming to learn how to do that. I'm not there yet. And also working on dietary patterns based on socioeconomic characteristics. So I had a brilliant MPhil student that did dietary patterns from different income backgrounds, and surprise, surprise, high income groups consume relatively 50% of their calories from ultra-processed food, which is less than the average, but they're still consuming half of their diets, but from ultra-processed food subgroups that are perceived as healthy. Meat replacements, dairy replacements, cereals, energy bars, which are usually a bit more expensive. And lower socioeconomic status groups are consuming more ultra-processed food overall, so about 68% of their calories, and are consuming things that we perceive more as unhealthy. So that comes with a lot of stigma. Oh, you're consuming crap. I'm not. I'm eating, meat replacements. So that comes with stigma, that comes with power, that comes with a lot of health inequalities. And we really don't know what is the differential impact of consuming one certain type of ultra-processed food and other types of ultra-processed food. More research is emerging, and it seems that ultra-processed food that are high in fiber, such as cereals, beans, are related to a reduced risk in morbidity and mortality, and that foods perceived more as unhealthy, especially artificially and sugar-sweetened beverages, have like a 10% increased risk in morbidity.
Sorry,
So that's where I'm at now.
Janina, I'm just aware that we're at 1 now, so
What a
I
way
sort
to
of cut
close.
I cut you off mid-sentence, but I think maybe if anything, that's a cue that we need to follow your research more. So I'll send out a few emails, one for the recording for the session, and also details for people to connect with you and to follow your research, because I'm sure there's loads of people interested, of course, in food systems, but also systems thinking in general. So I'll just say another massive thank you, Janina, for your session today.
Awesome. And some really cool collaborators in the call as well. So good to see you, familiar names, and very happy to follow through any questions. Just drop me an email.
Awesome. Okay, I'll be sending around details for our next session, which will be in January on the 25th of January. And I look forward to seeing you all again sometime soon. Have a lovely holiday season, and we'll wish you all well and see you in the new year.
You too. Bye-bye.
Thank you.